and so beautiful accent, with so beautiful Ukrainian. You your voice is so beautiful, but I don't understand any words.
All right. Could you please tell me if you see your presentation on the screen?
Okay, let me start or wait a moment.
Mm-hmm.
Uh, Good evening and good afternoon, everyone. So let me start. I'm very happy to present my experience regarding the burn scar treatment using laser. So let me check. So my topic is laser to treat burn scars. I'm Dr. Jeff from Taiwan, and I'm very happy to cooperate with BCA Burn Care Alliance. So let's work together and learn from each other. So next slide, please. The first I wanted to talk is about what is Frexel CO2 laser. CO2 laser is a CO2 laser is a laser use carbon dioxide as a medium for emit light. The wavelength of CO2 is around 10,600 nanometer, which is strongly absorbed by water. So the target of the tissue is water. And the next is the fractional technology. Uh, Fractional technology is a kind of laser module that we use to treat a small region in a very small column to treat the skin region instead of ablative entire surface. So it leaves surrounding skin intact, which helps the laser healing become faster and more scarlet. So the next slide, the next. Okay, this is a fraction laser. Usually we have a two laser module. The first is Frexel CO2 laser. The other is Urban Yak laser. As we can see from this slide, we can see the fractional laser is mean that the laser treatment is a very narrow column that treat target tissue is water. And we can see the CO2 laser wavelength is 10,006 nanometer, which can penetrate more deeply into the epidermis, dermis, as well a part of subcutaneous. But in other kind of laser, we so-called urban yak laser. The wavelength is around 2,940 nanometer. The energy is a little bit small compared to the CO2 laser, so the penetration is also shallow. So in this slide shows the energy penetrate to the epidermis just a little bit to the dermis. In a compare of these two kinds of laser, next slide. The CO2 laser has a strong energy, so the depth of penetration is deeper uh, uh, compared to the urban bit shallow, and the coagulation also wrong. CO2 laser is significant, and the urban yak is minimal coagulation effect. So the recovery time, we so-called downtime. Downtime is a little bit longer. It required to 10 days when patient receive a flexo laser. If the patient receive a Irving Yak laser, the recovery time is a little bit faster, required 3 to 5 days. So it's a little bit different. The stronger the energy, the severe the injury of the tissue. Next slide. Next. In summary, CO2 flexo laser create a deeper, stronger, and more tightening effect, longer downtime, and the Irving Yak flexo laser has more gentle, faster recovery, less tightening effect, and safer for darker skin. So in Taiwan, in my hospital, because most of the color people in Taiwan, so we use more Irving Yak laser to replace CO2 laser in recent years. Next slide. This is Irving Yak laser in flexo mode in my hospital. So I use this flexo laser, use the wavelength with 2,940 nanometer, and I can set the energy with a reference from the slide. The module is 3 flexo with energy of 14 millijoule in this energy. It depends on the patient response. Okay, next slide. So I will present a case which I treat. The patient's complaint is that he has a fragile burn scar over trunk and all over his body. The basic data of this patient is a 65 years old man. He had a history of flame burn injury, 80% TBSA. Wow, it's a big injury at that time. Deep second degree to third degree. The incidence was happened 30 years ago. So when the patient is 35 years old, he got an injury and he received burn resuscitation, wound repair, skin grafting, and rehabilitation. And finally, he got healed and go back to his house, returns his work. This boy and this gentleman has no underlying disease. He is a non-smoker. Next slide. As he presented to my office, we can see he complains that the scar over his chest, this area, is very fragile. It easy breakdown and breathing when he take off his clothes, especially in the summer. Sometimes the clothes will adhere to his scar and make the scar easy breakdown and breathing. At the same time, we can also find there are several skin graft scars over his upper abdomen, right shoulder, as well as the right arm. So in his right upper arm and the forearm, we also can find burn scars healed by skin grafting, result a lot of irregular scar surface. So after I discussed with him, I try to use Irving Yak flexo laser, and the primary focus is his anterior chest. At the same time, I also treat the right forearm as a control target therapy. Next slide. So this is the photo after 2 sections of treatment. The scar over right forearm become more smooth as well compared to the left chest burn scar. The next slide, please. Next. This photo shows 4 sections of treatment. We can see the right forearm, and the left chest. Let's move to the next slide. Next. This is the 6th section of treatment. We can see the right forearm become more smooth, and the left chest, this area, the scar become more mature, and the scar breakdown decrease. So currently, this patient is still keep on the treatment. So I think 6th section of fracture laser obviously can help him. But if we want to make his scar more smooth and more mature, we can keep on fracture laser treatment. Next slide. This is the area of treatment compare before treatment and after treatment. And the next slide. This is right forearm treatment area compared between the before treatment and after treatment. Next. The clinical benefits of fracture laser treatment is improved scar pliability, reduce contracture and stiffness. The fracture laser also can smooth surface irregularities, reduce roughness, improve texture, reduce scar thickness, especially in hypertrophic burn scars. It also can enhance functions by softening contracture over joints. The cosmetic improvement is very important for the patients. After laser treatment, we will observe better pigmentation uniformity, reduce redness, and improve cosmetic outcomes. When in a dark skin types patients, such as in Asia or in Africa, it's more safer to use European laser compared to the CO2 lasers. Next. The advantages over CO2 fracture lasers compared to the using European laser. The European laser has lower and shallower penetration, so it's reduce the risk of deep thermal injury and less downtimes. Reduce the risk of post-inflammatory hyperpigmentation. It is better tolerated in sensitive area or thin skin. Next. The limitation of my treatment is that when using European laser, it's less collagen tightening because the weaker effect on severe contractures. It often requires multiple sections. It may require 3 to 6 treatments in my patients, although the 6th treatment is quite good, and we can observe a very good result. However, if the patient wanted to a better result, it may require 8 or even 10 sections. The adjunctive roles, when the scar is more severe contractured around the joint area, It may combine with CO₂-laser or surgical release, steroid injection, microneedling, etc. So, the scar treatment is a very difficult topic. It requires a lot of work on it. Next slide. It's my presentation. uh, any any questions or any comment from audience?
So I think this is the last slide. У учасників є якісь запитання до спікера або до презентації. I think everybody wants to wait for the Q&A at the end. So perhaps would you like to hear some of the questions I have now, or maybe at the end?
Okay. If other speaker is get ready, so we can discuss after all of the presentations.
All right, sounds great. So thank you so much, Dr. Juan. It was a wonderful presentation, very informative. I think all of the participants enjoyed it very much, so we'll wait for the questions at the Q&A session. And now I want to present our second speaker, Dr. Галина Саян. Бачу пані Галину вже тут. Одну секунду, я відкрию вашу презентацію.
Так. Дякую, що почекали. Ну, насправді, взагалом, дуже рада, що я встигла. Так. От. Ще раз усім доброго дня.
Доброго дня. Так, одну секунду. Підкажіть, чи видно презентацію?
Так, чудово.
Отож, хочу презентувати вам нашого другого спікера, Галина Саян, керівниця міського центру термічної травми та пластичної хірургії. Пані Галино, якщо вам буде зручно, можете як українською, певно, краще нам всі розуміли. Ці питання будуть самої презентації.
Гаразд. Мабуть, трішки щось перебивало. Отож, як скажете, мабуть, я ще все-таки вас перепитаюся, українською чи англійською? Мабуть, щось трошки перебивало.
Я думаю, що краще буде англійською, для того, щоб Джеф розумів і учасники, в разі чого учасники, якщо щось не розумієте, можете написати в чат і все перекладемо.
Так. First, hi everyone. My name is Галина Саян. Yes, I think I say it again. And today we will discuss about CO₂-laser and about some this role of CO₂ procedures for post-burn scars, but maybe not only for post-burn, but for post-traumatic scars. And truthfully, sometimes scars are not only like a complication, but sometimes after burns, it's like planned consequence. Yes, when you have some second B degree or deeper burns, we now, during our treatment of burns, we know that in the future, this patient will have some scars. Наступний, будь ласка. I'm beginning with slides that we have two CO₂-lasers in our burn center. So we have the first one is U-laser CO₂. It's we have it in St. Nicholas in Children's Hospital. It is a combination of Fraxel, it's like non-ablative laser, and CO₂-laser, it's like ablative. What's the difference between ablative and non-ablative? It's like ablative, we create some wounds. Non-ablative is just heating without wound creation. Another one, it is a CO₂-laser acupus. We have it in St. Lucas in adult burn department, and it just ablative laser. So we have some wounds after procedure. Наступний. So a little bit about what is it? Yes, what's some laser? What's CO₂-laser procedures? Burn scars, yeah, it's very common complication after severe burns. I think I said it a little bit earlier. And when you have some scars, we have functional and cosmetic impairment. Psychological impact on patient. We have when we have some scars. Yes. Maybe often we have when we have some patients, it's not depend of a variety of wounds, but very often parents or relatives of patients, they ask not about stable, yes, not about they're stable, because they can be some severe patients, but all time I hear some ask if it will be some scars or no after healing, yeah. And truthfully, it's true that scars have some, I think, cause some very psychological aspect. Yes, when especially if you have some children patients, if you have scars of face, of wrists, so some visible region. And we today we are discussing about CO₂-laser, but truthfully, we use not only like monotherapy CO₂-laser, but we combine this one with another. With another treatment, like some steroids, like some silicone or pressure garments, like another one. I think I will say it a little bit later. Наступний. So the fractional CO₂-laser is effective for burn scars. Sometimes when we have little scars, some contraction, we can do some surgery. But when we have some big area of scars, CO₂-laser is easy. Yes, we have a lot of procedures, a lot of every 2 months, but it's work. And when we have a big area of scars, I think it's very gold standard. So we are doing controlled dermal ablation, and after that we have collagen remodeling. So some benefits: improve scar pliability, reduces thickness, decreasing itching and pain, enhance cosmetic appearance. Наступний. So we will begin with our results, and I think these slides are very important because only when we can see some results before and after, we can understand that it's work. Yeah. First patient is children, very beautiful girl. She is blonde, and we know that when we have a patient with blonde hair, not dark, so it is more risk that we will have some scars at you, also especially some hypertrophic hair, or keloids, and sometimes. So we performed 2 CO₂-laser procedures, and we have 6 months between these photos. I also want to add that it was not only CO₂-laser, but I like to use corticosteroids, but not like injection in children, but after it's like home care after procedure. So they had betamethasone cream after procedure, because CO₂-laser is ablative, so we have some wounds, and steroids like betamethasone is act through these wounds. Yes. So what we have high, yes, less high, more flexibility, more pliability. Наступний. It's boy, 2 years old. He had a few operations when he had some burns, also skin graft, and we have some results for also 2 procedures. In this case, we also use betamethasone in home care. Наступний. It's normotrophic scars, but we also have some results. But when you have normotrophic, we use not only betamethasone in home care, but Aquaphor or another like Vaseline, like sterile Vaseline, when they go home. Наступний. It's also another girl who had 3 procedures, and it is 10 months between photos. Also, deep burns caused by Ukraine national meal holidays. Yes, it was fat. Yeah. Burns which caused by fat. Yes. Наступний. Another boy, 2 procedures, 6 months between photos. Also, we use betamethasone cream after procedure. Наступний. It just, yes, we have also scar, but we have a good result after 1 procedure. And this boy also will have another CO₂ lasers in future. Наступний. For procedures 1 year between photos is also another leg. I think maybe second photos or third it was here, yes. Наступний. Next slide. Outcomes. Improvement in scar playability. We have some Vancouver scar scale. So it's some scale that we can, it's like achieve, we can access what is better. So what is better with scars after CO₂ laser? And we rely on this scale. So what we can see that the scar more playability, color and thickness is better, and is less thickness, functional range of motion. And I think the best result is that patient satisfied about that. Yeah. Discussion. CO₂ laser is easy. So when you have some operation, patient need some period pre-operation, like some preparing for that. Also some period after operation, some stay at hospital, some infusions, some medications. But when you have some CO₂ laser, it's easy. It's more easier. Yes, we will have not only one procedure, but 2, 3, or more. It's depend on the patient case. Yes. But it work best for hypertrophic scars and contractures. But truthfully, for contractures, I think the best way is also surgery. May require multiple sessions. I think is minus, but it's not very bad. Often combined with other therapies. Yeah, I think that's all. Yes, some limitation. I think maybe Dr. Jeff said about that a little bit earlier, but we have some pain, redness, swelling after treatment. Risk of infection is not very big, but it is, and pigment changes. So we try to don't use CO₂ laser in summertime, especially face, wrists, or some visible areas. Yes, for sun, or some discuss with patient about SPF 50 plus sun protection factor. Yes, not suitable for all patients. Consider skin type and if patient have some comorbidities, or especially some virus infection, and in or some acute stage, some illnesses. And truthfully, for almost children, we use CO₂ laser just only under sedation, not only in local. But when children are older, or some adult patient, we can use like application like ointment. Anesthesia is easy, comfortable for both sides. Yeah. And наступний принцип. So fractional CO₂-laser improves burn scar outcomes, enhances function and quality of life, and a valuable part of multi-modal scar management. Я дуже дякую за таку можливість тут доповідати.
Дякуємо вам, пані Галино. Це була дуже цікава презентація. Я сподіваюся, що всі учасники зрозуміли її важливість та актуальність. Дуже дякую. Отож, будемо переходити до сесії Q&A, questions and answers. Якщо у вас є питання українською, можете задавати українською, ми перекладемо спікерам, або ж можете писати напряму. Однак я дуже попрошу всіх учасників увімкнути камери, щоб була краща комунікація. Отож, perhaps do we have any questions for Dr. Jeff or Dr. Sayan? Maybe people are still waiting. So I do have one question regarding the age-related contraindications for CO₂-laser treatment. Perhaps it will be both for Dr. Galina and Dr. Jeff. What is the youngest age where you perform the CO₂-laser ablation? For example, specifically in pediatric children, is there any age limitations?
Okay, let me first. It's a good question. During the Flexo laser regarding the CO₂ Flexo or urban yak Flexo, it's very pain. So I think pain tolerance is my major concern when I treat the pediatric patients. If the patients are younger than 12 years old or younger than 14 years old, I think he or she cannot tolerate the pain during the treatment. When the young adult, when he or her age above 16 or 17 years old, so the patient becomes a young adult and can communicate with the physician. So I think when I treat the CO₂ Flexo laser, the cut age may be around 15 or 16 years old.
Mm-hmm.
It's my experience. How about Hannah?
Truthfully, we performed CO₂-laser for very young children. It can be 2 years old, but all these procedures are under sedation, under general anesthesia with anesthesiologist.
Mm-hmm. So basically 2 years old would be kind of like a limit.
Yes.
Okay, we do have another question of how available is the CO₂ laser in Ukraine?
I think it's my question. Truthfully, CO₂-laser when is maybe almost all cosmetologist clinics, yes, dermatologist clinics, but I don't know if all of them have some sedation and possibility to use it in children. But if I have some adult patient with scars, it's not problem to visit theirs, yes, and to have this procedure. But when we say about big area, about children, so patient who need to do it in operation room, in under sedation, I think, and also good painkillers after procedure because it's painful. I think the best way is to do it in hospital. We have two. We have our burn center is divided into burn and adult, into burn for adult department and for children, and we have two these lasers for both of these hospitals. And in Lviv we have it. We have it available. But I don't know about in other cities. I think they have only in private centers. But maybe my answer is not exact.
Можливо, тут є якісь лікарі з Києва або з інших великих міст, хто може також прояснити ситуацію про доступність лазера у їхніх центрах? Or perhaps not. Можливо, ні. We do have another question regarding the itching after procedure. So, can you say, Dr. Jeff and Dr. Halina, is there any itchiness for patient after the procedure of laser treatment? And how can you erase such a symptom? So, how can you elevate, for example? Get rid of the itchiness for the patient.
The question is stated the itching of the scar. Yes. Actually, when the burn scar mature or during the mature period, itching is very, very, very troublesome for the patients because when the scar itching, especially in hot summer, the patient cannot full rest, especially when the itching will interfere that the patient cannot sleep well during the night. So the patient may come to my office for seeking the itching treatment. I think a CO2 flexor laser as well as steroid injection cannot lock injection can also alleviate itching sensation. So I think a steroid injection and laser treatment is helpful for the patient. But on the same time, I also give some topical ointment, such as steroid ointment as well as indomethacin ointment that can reduce inflammation response of the scar, so it can also alleviate itching sensation. So my treatment modality is included steroid therapy, laser therapy, and the topical agent. The topical agent is very convenient because the patient can take it home, treat the wound, treat the scar by himself. But the laser or injection should come to the hospital.
I also want to answer about the question. Okay, Victoria. Truthfully, two aspects also. First of all, when we have hypertrophic scar, yes, which is high on the skin, we also use in first period steroid ointment. But if you have dermatrophic, we use just moisture. Is a first aspect, moisture. Also, just Vaseline, just sterile Vaseline, for example. And secondly, if we have no result with that, we can use also antihistamine like phenystyl in children or in other first generation is more rapid, but a little bit with sedation effect. But you can also use oloratadine or suprastine or second. Or suprastine at overheal, it doesn't matter when we have no result with moisture. It's our treatment.
Okay. We have another question from Dr. Metropasichny. How do you combine laser influence with hypothermia or cryotherapy?
Okay, let me try. Actually, I don't use hypothermia or cryotherapy. If the patient feel itching or pain during the treatment, I will recommend that ice packing ice picking, that means we put some ice wrap in a plastic bag that can cool down the skin. So I also cool down the skin temperature, but actually I don't treat cryotherapy. Okay, so the skin cool down is also reduce the pain or itching sensation. It's a little bit it's a supplemental therapy, not the main therapy, is my opinions.
We have no this experience. So I think I have no answer about this question. But I know that my colleague from another city, they like to combine, but not laser, but injection with triamcinolone, like analog, and with cryotherapy in one procedure. I saw good result, but I have no experience in this.
All right. Thank you so much for both of your answers. Perhaps do we have any other questions? Perhaps we'll wait for the participants to write. I do have another question as well regarding the distension on the scar wound. For example, in clinical practice, how often do you opt for surgical scar release surgery instead of the CO₂ laser? And for example, what would be the indications for choosing the surgical approach versus the CO₂ laser? Dr. Jeff, you're muted.
Okay. It's a good question. Since we are plastic surgeon, so surgically treated scar is our primary concern. What is the indication to use surgery to treat the scar? I think if the scar is severe contraction and there is evidence of tissue deficiency, I think is an indication for surgery. Last week, I attend a regional meeting in Asia Pacific. This area we called Asia Pacific Burn Conference in India. And I present the scar treatment. If we have time today, I have a slide to share with all of my friends here, and 10 minutes talk regarding the scar concept. So if you wish, I can present it today.
All right, I definitely wish, but I'll have to ask the participants regarding availability. So let me ask in chat. And meanwhile, Dr. Галина, as well, the question, how often would you alternate between the scar release tissue, or would that be the different department that does the surgical part of it, or would it also be the burn surgery unit?
From the time that we have CO₂ lasers, and also in both department, and also realize that it is easier, that it is more easier than operation. So we have more CO₂ laser procedures than operating. But we have to understand that when you have big area of scar tissue is very good, is really gold standard for treatment. But when we have some contractures, when we have some big linear scars that we can exercise, that we can do with some plastic, yes, it's more often to operate them. So it depends what we have. And if we compare about amount, CO₂ laser is more, but it just that it is more easier, and it needs more procedures. Yes, when we have to operate, we can operate at once, and that's all. But when you have one scar for CO₂ laser, it needs more procedures.
Thank you. We totally understand that it will be more procedures, so definitely more traumatic for the patient as well, but still interesting regarding how that alternates. Отож, шановні учасники, замість того, щоб писати в чат, хочу спитати у вас, чи маєте ще ви час, щоб послухати the scarless tissue surgery? Чи будемо завершувати? Якщо ваша ласка, хтось відгукніться. I think we still do have 10 minutes until the 3 p.m. in Ukrainian time. Oh, okay, so here we go. The participants definitely said that they would love to hear about the scar release surgery. So Dr. Jeff, your stage, please. Would you need for me to showcase any materials or presentation or just...
Okay, my slide is here. May I share my screen?
Yes, of course. Give me just a second. I will make you ahead.
Let me share. Okay. Is it clear?
Yes, I can see.
Okay. This topic is my presentation last week in the Asia Pacific Burn Congress 2025 in India. And the topic I'm presenting is reasoning, scars, and analysis through the dimension of the physics. I have nothing to disclose during the conflict of interest. What is a scar? Scar is the tissue regeneration or repair with result of excess fibrous tissue to replace the original skin alignment. And we all know the scar was developed during the healing process of the wound repair. So we also know the wound healing start from hemostasis stage and acute inflammation, late inflammation, and finally with scar remodeling. This is my concept of the scar when the skin breaks down like this. So we try to repair it. If we can repair it with a perfect alignment, the scar will minimize. But sometimes the collagen did not repair in a very alignment. Is not in a good alignment, so irregular collagen deposition will become a scar. There are many types of the scars, including the linear scar, hypertrophic scar, keloid scar, or atrophic scar. The color of the scar may also different from each other, such as hyperpigmented or hypopigmented erythematous scar. Also, the severe scar, contracture, or depressed scars. So this is a lot of burn scar types. So what is my concept is to re-examine the scar from the dimensions of the physics. What is the dimension of the physics? We so-called zero dimension is mean a point, just a position, no length, no width, no height. One dimension is mean a line, length only. And two dimension is a plane. Three dimension is a solid. Solid include length, width, and height. For example, a cube. So this is the concept of the dimension from the physics. When use this concept, the scar dimension we so-called zero dimension is a point scar. It's seldom to cause clinical problems. And the one dimension is linear scars, such as we make a excision and the suture repair. It result as a linear scar. And two-dimension scar is a planar scars, such as skin grafting scars. The 3D dimension, three-dimension scar is a solid scar, such as we discussed earlier. The scar may be elevated or depressed. So the dimension when we try to examine the scar, I will use this concept. The first is the height or level mismatch. So the scar may be elevated or depressed. And the color and the texture or consistency mismatch. The scar may be firm or soft. And the final one is the color mismatch. The color may be hyperpigment or hypopigment. So the is a scar mismatch. This is my therapeutic approach to scar treatment. If the scar is level mismatch, the elevated scar make it soft or flat. If the depressed scar, it may require the soft tissue augmentation subcutaneously. If the texture is mismatched, the firm scar, I will try to make it soft. If the color mismatch, the hyperpigmented scar, I will reduce the pigmentation and fade scars. If the scar is hypopigment, it may require melanocyte transplantation. This is some examples of my scar treatment. This is a young boy with a burn scar over his right hand, result as a scar contracture, which limited fingers movement. So I release the scar and release with adequate length. This is another case with a scar contracture over the finger. So I make a G-plasty with release scar. It can for extension now. This is a young lady with right cheek pigment scar result after a trauma. So I make a scar excised with a W-plasty. And finally, the result will become less obvious. This is a elevated hypertrophic scar, and I treat it with a steroid injection combined with laser treatment. So the scar will alleviate less obviously. This is a severe scar over anterior chest skin. And I treated the scar with surgical excision as well as laser treatment, steroid injection, and finally the scar become less obvious. This is a trauma scar over right foot dorsum with elevated and firm scar tissue over right foot dorsum. So I treated the scar with excision and the steroid injection. And finally, the scar healed. Also, silicone sheeting. The scar become less obviously after treatment. This is a surgical scar with elevated scar and hypertrophy. So I excise and keep a scar therapy. It's finally become more soft and white. This is the last case with a severe trauma over right hand after a traffic accident. Well, it's a big injury for this lady, and I treated the wound. Initially, after surgical remove necrotic tissue and fixation of the broken bones, I treated the wound and healed by skin grafting. Result a bigger pigment depressed scar over her right leg. And I use tissue tissue expander to expand the skin and resurface the scar area. And finally, the scar was closed with a linear mild depressed in her right leg. The conclusion is that the most important to reduce scar is treat and heal the wound as early as possible. And when we evaluate the scar, I usually compare with the surrounding normal skin. Pay attention to the key characteristics of the scars. Please keep in mind that I correction the height or contour mismatch, correct the texture mismatch, and finally, correction of the color mismatch in this sequence. That's my presentation. Thank you.
Thank you so much, Dr. Juan. It was very interesting. Perhaps, do we have any questions from the audience? Можливо, у когось є якісь запитання до пана Хуанга стосовно лікування шрамів? If there are any questions, we'll wait for the people to write them down. But just wanted to say that it really reminds me, the joke about main principles in dermatology. If it's dry, make it wet. If it's wet, make it dry. So,
yeah, yes, it's true. Neutralize it.
make it up.
Yeah, true.
Наразі бачу, що немає запитань. Є запитання. We do have a question from Victoria. So regarding the effectiveness of usage of silicone plaster. Perhaps do you use the silicone plaster often, and how does it affect the patient's outcome?
Yes, it's a good question. Yes, I do. I use silicone sheeting to compress or prevent the scar elevate. If wound healed or after the surgical treatment, and I use silicone sheet to prevent the scar elevate. But in Taiwan, it's Southeastern Asia. In Taiwan, the weather is very humid, especially hot in summer. So if the silicone sheeting, the patient cannot tolerate during the summer season, so the treatment effect is not so good because the patient compliance is not good in summer. But in the winter, the patient more will to put on silicone sheeting, and the result will get better. It's from my clinical observation. So I think silicone sheeting is a good treatment strategy to prevent the scar elevate. But if in the late stage of the scar, I mean that the hypertrophic scar has already developed, the silicone sheet may not effect to reduce the height of the scar. It's my opinion. Thank you.
Dr. Sаяn, perhaps do you have anything to add regarding the usage of silicone scars? How often do you use it in your practice? Oh, you're muted. Без мікрофона.
Дякую. First of all, silicone sheets is like one type of compression, but we can also use silicone gels if we have some face or some visible zones, yes, because silicone sheets is not comfortable for patient. And if it is not comfortable, we also can understand that they will not use it, yeah. So silicone gels, silicone sheets, and compression garments. Compression garments is, to my mind, more effective because when we also have some individual compression closures, yes, because it's it's comfortable. It's have a good compression for the region that we need to have more to have compression. And also, I just want to say that your question is about silicone plastines. We can use it like prevention, like Dr. Jeff said earlier, and also like treatment. For example, like prevention is when our wound were healing, and we prevent to growths to hide the scar. Yes, it's like a first using of this compression plastins. And secondly, when we do some CO₂-lasers or some analog or triamcinolone or another steroid injection, we reorganize scars. And when we say about CO₂-laser, 2 weeks after, we also can give our patients some silicone plastins or another type of compression, and it also will be like combined treatment, so we will have better results after CO₂-laser or another procedure. Do you agree with me?
Yes. Yes, good.
Okay. Можливо, ще якісь
Okay.
питання? Thank you so much to Dr. Sayan for it.
Mhm.
All right. I think this might be it for the questions. We have a little bit overstretched our limit of time, but I do want to thank both Dr. Sayan and Dr. Juan for your time and for your participation today. Both of the presentations were incredibly fulfilled and incredibly valuable, I'm sure, to all of the participants here. So thank you so much for your time. It was really incredible to see you perform, and we would definitely want to see you again with more cases in the future.
Sure, no problem. And I'm very happy to share with you, and hope to see you next time.
Of course. Thank you so much, Dr. Juan. Thank you, Dr. Sayan. І дякую також учасникам, які знайшли сьогодні змогу доєднатися у вихідний день, розумію, що субота. Тому бажаємо всім гарних вихідних. Have a great weekend. And till the next time.
See you. See you.